What is minced moist chicken? How do you make it? What's it used for? All great questions. Hey folks, I'm Simply Thick John. I love to teach about the International Dysphagia Diet Standardization Initiative, which I will refer to as IDDSI. Minced moist is a level 5 food, which is used for people who can have some chewing problems, things like that. They may not be able to fully chew their food, but they can do a little bit of chewing. So it's not quite food ready to swallow, but it is processed down to a size where they can complete that chewing and that they can swallow it. So it's going to be below 4 millimeters in particle size, but it still has chunks. You're still going to be able to chew it. You're still going to be able to enjoy it. So when you make something like minced moist chicken, we start with our cooked chicken. And this is true with any protein. The process I'm going to show you here works very well. I just happen to be using chicken today. So I start with my chicken, and I put it in the processor. And now when I run it, you'll see that it chops down very quickly and pretty efficiently. That's what food processors are made to do. And now what I'm going to do is I'm going to scrape down the sides because we want to make sure that all of the particles, all of the chicken gets processed. Sometimes it can get stuck under the blade there, so you want to just make sure nothing's stuck there. And it's a very quick and easy process. Now when I run this, because of the dryness of the meat, it is not going to process down to a puree. It's going to stay at that minced level. So you can see it's just processing, pushing that around. And yes, we have a minced food. It is probably the right particle size for minced and moist, but it is not going, it doesn't meet that definition of moist. It has a lot of dry crumbles to it. I'm going to put it in the bowl and we'll take a look at it. All right, so we have that out. Now, as you can see, this is dry and crumbly. This is not what I would call moist. It's not sticking together, and that's what you want for something that's minced and moist. So how do I moisten it? I use my level 4 extremely thick stock. This is just stock that has been thickened. It could be vegetable, it could be chicken, it could even be beef or something else if you want to add some other flavor. And I just use it, I squirt it on top, and then I mix it in, and what that does is that moistens it very well. And so as we're processing it, you can see just that little bit of extremely thick stock really changes this from being a dry, crumbly thing to being moist. And really, the whole point here is that the International Dysphagia Diet Standardization Initiative, minced and moist, is supposed to simulate when you've been chewing this yourself. And we're substituting a lot of natural chewing for what we can do in the kitchen. Let me show you a couple things here. When you put this on a spoon, this is how we test it with the International Dysphagia Diet Standardization Initiative. It mounds up, it stays there fine, and with a gentle flick, it just dislodges. It doesn't stick to the spoon, it just leaves a little bit of film. It's not that big of a deal. And then when I pick it up with the fork, because I use that extremely thick stock versus a thin liquid, there are no separate loose liquids that are there. And this is what I would call a very good minced and moist food. The other thing we want to do is check the particle size. And what we do to check the particle size, we make sure it fits between the tines of a fork. And you can see that does easily fit between the tines of a fork. The reason we do that is because the tines of a normal fork are 4 millimeters apart. I've tested mine here to see that they're 4 millimeters apart. And I have these IDDSI training cutting boards that I use to make sure that these particles are smaller than those 4 millimeter squares there. And then it's also helpful because it has the testing methods that I've already shown you with the fork drip and the spoon tilt test. So this looks like a wonderful minced and moist chicken. Now let's talk about presentation. Classically in the food service industry, you would see food served kind of just like a plop and drop or a scoop. That's not very appealing. It makes it look like it's not chicken. I believe that when you form food and you shape it, that people are going to be able to identify it as chicken, they're going to think more, and they're going to consume more calories. So we've developed this handled food form, which is a quick and easy way. You can set it on your counter or your tray line. It's not going to tip over. It keeps this area sterile. And all you do is you spray it, the little release spray, and then you put your food in there. You could use a scoop, or in my case, I'm just going to use a spoon today. And you just fill it up. This holds 4 ounces, so you could put in 4 ounces of meat if you wanted. If you're somewhere where you're doing like a 3-ounce portion or something like that, it's still going to shape it just fine. It's quick and easy to do, as you can see. I just put it in there, And then all we do is we put it on the plate and we give it a little flex on that point there, and then it will come out. And now you have a chicken breast that looks like a chicken breast. You could dress that up if you wanted. You can put some browning sauce on there to put some grill marks, or you could put some barbecue sauce on there, whatever you want. The idea is to make this minced and moist food as visually appealing as possible, because we eat with our eyes. So even though I've shown you the technicalities of it, when it comes down to it, how you present it is going to be just as important. And that's how you make a nice minced and moist chicken breast. Anyways, folks, please like and follow for more great content on the International Dysphagia Diet Standardization Initiative just like this.